Welcome to Wildlife Rehabilitation from Rescue to Release, a podcast dedicated to licensed wildlife rehabilitators and the veterinarians who support them. I'm your host, Gail Buhl. Techniques we discuss here are meant for licensed wildlife professionals. If you aren't licensed and trained for wildlife rehabilitation, do not attempt to capture, hold, or rehabilitate any wild animal. If you find an injured wild animal, a wildlife professional can recommend next steps. We will tackle topics about rescue, care, management, reconditioning, and releasing wildlife found in North America. This is a deep dive into each subject. We hope to give rehabilitators information they can use because they're already going to great lengths to rescue and nurse animals back to health. There are three possible outcomes in wildlife rehabilitation: release, euthanasia, and placement. An injured or orphaned wild animal's journey to restored health and independence in their natural habitat is delicate and complex. We draw techniques and expertise from many disciplines. Many animals brought into rehabilitation cannot be saved. The last gift we can give them is humane euthanasia. We'll talk more about when this is necessary. Sometimes animals are deemed non-releasable and evaluated to be suitable for a life in captivity. When that happens, we shift to a long-term approach to managing their care, training, and housing. Some such animals serve as ambassador animals, a term for animals that rehabilitators use to educate the public. Each episode, we'll speak with experts who represent specialty topics across the profession of wildlife rehabilitation, ambassador animal care and management, showcasing best practices. I'm glad you're back. This is part 2 of my discussion with Dr. John Huckabee on the art of wildlife rehabilitation. If you're just joining us, Dr. Huckabee is a retired wildlife veterinarian who began his career in Houston, Texas, and later worked at the Seattle-based PAWS, the Progressive Animal Welfare Society, for many years. Here in part 2, we dive back into my discussion with Dr. John, starting out with the sometimes hard decisions we must make to do what's best for the animal.
Beware of the trap of trying to keep humans happy. Keep the decisions and actions based on the animal's welfare and well-being, and not on your emotions or the emotions of others.
Mm-hmm. And that can be hard. That can be really, really hard to separate that. It just,
right.
And all of us, and for ourselves too. And we're talking about the humans, trying to keep the humans happy, that you have to consider yourself in that too. Because sometimes if you've been, having to euthanize or witness several animals' deaths in a row, I mean, it gets heartbreaking. We get into wildlife rehabilitation to quote unquote save animals and release them back to the wild. And so it's just really difficult. And so sometimes you get to this next one that you're like, probably needs to be euthanized, but you just can't do it. And then you just either keep trying or whatever. So you have to take yourself in consideration there.
Yeah, and compassion fatigue is a very, very real thing.
Mm-hmm.
And trying to nurture yourself and your own soul through sometimes a soulless practice.
Right.
That's something that is also a part, I suppose, of the art of wildlife rehabilitation, is self-care and making sure that you are at your best to do the best for your patients.
Right. Because I do euthanize a lot of animals with my veterinarian's help, right? But I really try to reframe what's going on, because the circumstances for that animal coming to me may have been tragic, whether it's hit by a car or whatever. I've got a mama duck with a lot of ducklings, and the mama duck has a compound fracture and the bone is dead. I mean, we cannot save this animal, right? But to euthanize that animal is also a release. And it's a gift. It's hard. It's emotional. But knowing that you're actually still helping. You're still helping that animal.
Right. Absolutely.
So that's the other thing that I really try hard, even after all these years, to just reframe how I'm thinking about it. And then I also, I've been in this business for a very long time, and it doesn't mean that I know everything. It doesn't mean that sometimes I look at something and I'm like, I know, but I'm always talking to my mentors and my other veterinarians and rehabilitators, and trying to come up with, am I thinking about this right? Here, can I show you some pictures or the radiographs or whatever? And am I thinking about this outcome or my plan of action? Is this sound okay? We shouldn't be silos at all. And hopefully you all have really good mentors that you can work with.
Oh, yeah. Yeah, and I couldn't agree more with all of that. Such an important part of successfully being a wildlife rehabilitator is being able to manage those different factors.
Right. Exactly. Yeah. We've talked a little bit about how, you sort of recognize the art of wildlife rehabilitation, and it's pretty hard, but you kind of know it when you see it.
Right.
And I think for folks that are just getting into the business of wildlife rehabilitation, the question that probably would come to mind if you're watching another wildlife rehabilitator is, how did you know how to do that? How did you see that? If you start getting those questions in your head, you're probably looking at the Art of Wildlife Rehabilitation.
Right. Yeah. Oh, absolutely.
Yeah. So that's one of the things that kind of occurred to me. And then, you just, I also think that for people who are just learning, or me on this lifelong journey, is don't be afraid to ask questions. There is no such thing as a dumb question that's asked in all earnestness, right?
Right.
There's dumb questions when you're trying to be dumb, you're trying to be silly or whatever. But really, if you're asking in all earnestness, there's no such thing as a dumb question.
Right. Yeah, again, absolutely. Agree with that too. There's
right.
an example that comes to mind that I think might help pull a number of these concepts together just in the story of a little black bear cub.
Ooh, we like that. We even I like the species too. All right, let's hear it.
Yeah, it's one of my favorite recollections, and it's a story about the Acme Bear Cub.
Okay, that sounds like a cartoon, Dr. John.
Yes. It has nothing to do with the Wile E. Coyote or Roadrunners because it's about a real black bear cub in from the Cascade Mountains north of Seattle.
Okay.
So the story of the Acme black bear cub is that winter was just beginning to settle into the Cascade Mountains north of Seattle. In the foothills of Mount Baker, a runted bear cub was found close to the small town of Acme and was brought by a state wildlife officer to the Paws Wildlife Center for evaluation and care. Now, typically, a yearling black bear boar in the first weeks of December would be going into hibernation with his mother for the winter, and at that point weighing upwards of 75 pounds or so. Now, this little guy had been separated from his mom for several weeks or possibly months based on his very small size and poor body condition. His attitude was much larger than his tiny size, and he was obviously quite weak and dehydrated. His body condition was thin to emaciated. He weighed in at 14 pounds, was limping dramatically on his left rear leg, and had a draining wound on the lateral side of the left thigh. A healed, mild to moderately displaced fracture of the mid-femur was palpable, with a very stable callus and a slight angular deformity. Somehow, he was barely managing to survive on his own, and certainly would not survive the winter on his own. His left leg was about an inch or so shorter than the right, and he was bearing weight on his toes rather than placing the foot fully plantigrade. Part of the reason for the shortened extension of the leg was the contracted scarring of the web of skin between the body wall and the medial thigh. It was not possible to get even close to full extension of the leg, even with the cub under anesthesia. He was too weak and debilitated to do more than take x-ray films and some initial blood work, give fluids, take a culture swab of the infected wound, begin antibiotics, and quickly recover him from the gas anesthetic. He needed supportive care and time to gain strength before doing anything more invasive. And over the next week, he gained strength and began to put on some weight. The antibiotics were not working to control the drainage in the left thigh, and it was apparent on the radiographs that a sequestrum, a piece of dead bone, was at the site of the fracture. So this dead bone fragment would have to be removed surgically to enable the drainage to resolve and the infection to clear. After another week of supportive care, getting stronger and gaining weight, the cub was anesthetized for ultrasound visualization of the draining tracts, the surgical sequestrum extraction procedure, and flushing the wounds. Photos and measurements were taken of the scarring and skin contracture to consult with surgeons for a surgical repair plan using advancement skin grafts to restore more normal skin length and allow for normal leg movement and foot placement. Plans were made for the skin surgery in a few weeks to allow for recovery from the sequestrum extraction surgery and for him to gain more weight and strength. Meanwhile, close to Mount Rainier in the southern Cascade Mountains, a sow and her yearling cub had been seen hanging out around a horse barn for a couple of weeks. This black bear sow was having difficulty walking and appeared weak. Both the sow and the cub were trapped by another state wildlife officer and brought to the Wildlife Center for evaluation. Unfortunately, the mom had gunshot wounds that were severely necrotic. The bullets had fractured her left foreleg and carpus and hopelessly shattered her mandibles, necessitating euthanasia. Her cub had no apparent abnormalities, other than now being an orphan in the middle of January, when she would have normally been hibernating with her mother. The female black bear cub was a cinnamon brown color and about twice the size of the male cub. The little male was deep, true black with a small white blaze on his chest. He was healing, growing, and gaining weight rapidly. The leg wound was no longer draining, although he was still only able to bear weight on the toes of his foot due to the skin scar contracture of his left leg. After the cinnamon cub had been in care for the mandatory 10-day quarantine for incoming cubs, we decided to place the two cubs together since they were now approaching the same size. Since the cubs would not be induced into hibernation, we knew there would be time to do the skin extension procedure later in the spring. The two rapidly bonded and began acting like siblings, arguing, wrestling, chasing each other over the logs, rocks, and stock tank pool rims, all the things rambunctious bear cubs typically do in the facility. Within a couple of weeks, the black cub was starting to place his left foot more plantigrade, and about a month later, his gait appeared to be within normal limits. So, with exuberant use and his rapid growth, the complex surgical skin grafting procedure was not needed. And by the time he was released, within a dozen miles of Acme in early June, the little black cub weighed well over 100 pounds and was a most handsome young boar. The cinnamon cub was also a vigorous, healthy, and beautiful young sow and was released back into her home region about 200 miles to the south. So hopefully that can show that the best laid plans, and sometimes very complex plans, may not be needed if management within captivity can allow for complete return to function and the ability to survive.
Yeah, there's several parts of that story. It's a wonderful story. And now I know why it's the Acme Bear Cub. But, it was, okay, we have this plan for this little black bear cub. And, okay, we're following this plan. But then opportunity knocks. And you were open to, hey, this black bear cub is getting closer and a lot healthier, except of course for this surgery you wanted to do. But maybe let's let them be together. And that, again, we talked about that earlier, for black bear, this time of their life, they can be very social and letting them, entertain each other and run around and be normal. And you said it, the fast growth rate, all that kind of stuff just made that surgery really not needed. And how wonderful is that? And to recognize it and not just go forward with it. Well, because we planned for this, so we need to do it. But those observations and watching and all of that, I think that That's an excellent story for the Art of Wildlife Rehabilitation. So thank you for sharing that.
Well, certainly. And just it was a huge relief to see how well the cub did. And I would be very cautious to say that even with the surgical procedure, if we did that, I don't think the outcome would have been any better at all.
Sure.
So, so just being able to put those things together on the fly, essentially, is part of the art.
Oh, right.
And I think in recognizing it, I think that's just one example that brings in a lot of the concepts of it. But the other examples could be very far-ranging, indeed. But the essentially successful captive management, captive care, conditioning, and release of difficult and challenging conditions, challenging species, and individuals is a metric that can possibly be used to measure, a metric to use to evaluate the art of wildlife rehabilitation, and having the outcome and knowing the chance of survival for that little black bear was optimal following release.
Right. And when we're releasing them, we want to release them so that they're at the level of conspecifics that are out there already, right? We're not necessarily trying to make them better than, but we're definitely not wanting them less than capable than the ones that are out there. So that of course is a big job. One of the things that struck me as far as another part of the art, and I see this repeated over and over and over again. I work a lot with raptors. And when we do a lot of renesting and fostering of young raptors, and one of the things that we try to express to other folks that are learning how to renest is that when you're putting these babies either back in a fake nest or back into the original nest, whatever, most of the time, or let's say they don't need to go back in a nest, they just need to go back on a branch or something like that. You want to put the babies back hungry. And we don't want to do that. We want to put food in their mouth and food in their belly, but we want to put them back hungry. And we do because that is probably the number one way that the parents find the chicks, is by the chicks calling for food. So when you're a brancher or just a brand new fledgling and you're moving around, that's how your mom and dad find you to stuff food in your mouth. And if you're not hungry, you're not going to call. So we want them to be ready to be out there, right? So they're stable and they're good weight and all that kind of stuff, but they need to be a little hungry to do that, to reunite with their parents. So that was just another thought I was having when you were saying, I'm like, how would I apply it? What kind of stories would I tell? That story, I want to ask, like, how do you learn the art of wildlife rehabilitation? I think we've touched on a lot of different pieces and parts of that, learning natural history and, increasing your observation skills and stepping back, talking to your mentors and things like that. And, talking to other people to kind of get a better idea. And the other thing that I was thinking about, and you mentioned this, is being outside the box, or, trying different things. So maybe you don't know a certain piece of natural history and you're having difficulty figuring this out. Well, there are biologists out there that probably have a specialty in that area. And most of them are pretty open to, if they're not out in the field, but pretty open to, answering questions and things like that to help you. Right. So all of that. I mean, we're better together than we are apart. So using all those different disciplines and thinking outside the box, I think is a very valuable tool.
Oh, absolutely. Absolutely. And for some of us, we can't even find the box.
Right. So. I know. And that the other thing, you can't even find the box, but I think a little piece of the art is you may know a particular species really, really well. So let's say you really know red-tailed hawks. I'm going to lean on my my raptor background. And red-tailed hawks upside down, backwards, forwards, whatever. And how to renest them, what time of year, ages just by looking at them and all this stuff, right? And now you're presented with a great horned owl chick.
Mm-hmm.
And you've not dealt with great horned owls before. Well, yes, they are a raptor, but their natural history is very different. And so the natural history can help guide you, but then you can borrow things from what you know about red-tailed hawks. I mean, there's other cautions you have to be careful of, like when are they active? So you have to be a little careful there. But I think you can also extrapolate from species that are semi-close to the species that you're looking at.
Right. Oh, absolutely. So and that's where understanding the fundamentals and the basics. Well, as a raptor, there are certain basics. It's living and breathing. There are certain basics. It needs to be well hydrated.
Right.
Well, first of all, it needs to be able to breathe. It needs to have a functioning heart.
Right.
And then it needs fluids in order to take care of it. So a lot of the basics can be done regardless of the species, and in order to stay alive. And it's beyond that you really need to have the ability to find that information, and finding mentors, like I said, is crucial to being able to learn, because you can learn from those with experience and success with the species or the condition or the presentation of that animal. One caveat with this, I would suggest that you respectfully avoid those who say that they have the only or the best way to do something or anything. So after learning from them what they do and how they do it, and if it's appropriate, adapting their techniques to your work and your situation or facilities is a skill. And recognize that even the crazies often have nuggets of wisdom. And it's up to you as an artist to figure out what those nuggets are, and then just delete the rest.
And you're saying that because we both are kind of in that category of crazies.
Well, kind of.
Kind of. We're both nodding our head for those of you listening.
But the point is, there's not a one size fits all.
Right. And there's a lot of right ways to do something.
Right. And their circumstances, their facilities, their time, whatever it is, it works for them. So it can be the best way for them to do something. But that's not going to necessarily work for you or another rehabilitator or others. So just to, again, just consider the source of the information. Trusted mentors are going to be your best way to learn multiple things, and be willing to accept challenges and to learn from your mistakes as well.
Oh, I'm glad you brought that up. Yep.
Yeah. One of the first rehabilitators, vet techs that I worked with, advised me very early on to learn something from every animal you kill. And I thought that was amazing advice. And it's something that I have tried to do over the course of my career. And it's something that in recognizing where your mistakes are, if it's do an evaluation after the fact to figure out, well, what went wrong? Where did it go wrong? How can I avoid doing that again?
How can you learn from it?
A process that I think it's important to incorporate into your practice as a wildlife rehabilitator.
Right. Oh my gosh. I think that is amazing advice. Learning from your mistakes and acknowledging them. We all make mistakes. All of us do. And learning from them, even if it's somebody else saying, well, you might would have tried this, or this is what I would do again. I mean, accept it and learn from it. And then the idea that, I was also told that advice to learn something from every single animal that comes into care, but really every animal that dies or you have to euthanize, that you have to kill, you need to learn something from it. And one of the things I tell you, that's how I really learned how to do a physical exam is because you can't hurt them, you can't stress them out anymore, but oh my goodness, can you learn a whole lot about how to see things and how to feel things. And you can flip the animal over, back and forth, look at the feathers, look at the fur, whatever it is, you can get so much information. Look at the parasites and then kill them. But sorry. Parasites.
Yeah. And I think you just brought up a very important part of observation skills in the palpation.
Yes.
And being able to feel things is a learned skill in order to really understand what it is that your fingertips are feeling or seeing.
Right.
So practicing that on before doing an necropsy, doing any kind of an evaluation, be able to feel the slightest difference between sides of the animal. Most structures are fairly bilaterally symmetrical.
I know. Look at that. You've got a built-in guide, right?
Yeah.
One side feels different than the other, then one of them is not right.
Right. So they're just all a part of the learning process. And having experienced and trusted wildlife rehabilitator colleagues and mentors, wildlife vets, and going to conferences and finding reliable and accurate resources, not unvetted social media or Dr. Google.
That's right. Dr. Google.
But from trusted resources that you can rely on the accuracy of information. Also becoming immersed in the field and pursue every learning opportunity possible for you. Because there's so very much to learn, and then figure out how to apply that successfully for you, for your facility and your circumstances. Identifying areas of interest in which you may be lacking. For example, when attending general vet conferences, I would specifically attend the surgery and wound management sessions focused on domestic species to learn the latest and greatest techniques and products from the experts. And then I applied what I'd learned to wildlife patients.
Right. So you have that different lens that you can then apply it, right?
Yeah. Right.
Excellent.
Right. And just listening to the lectures, and I was like, well, I think that would probably work for me in this situation.
Right.
And then being able to do that. With so many hundreds of species to apply the information to.
Exactly.
But that's just one example of where some of the focus, when I would go to the vet conferences that really didn't have much in the way of even exotics instruction, and certainly not wildlife. How was I going to be able to learn and keep up with the profession, as well as become the artist that I wanted to be in the wildlife rehabilitation field?
Wow.
So there's also an adage that in many trainings is see one, do one, and teach one. And
in the naturalist world, we have something like that too, called each one, teach one.
Yeah.
So it's very, very much the same.
Yeah. Teaching is one of the very best ways to learn and improve your skills. And I've learned a massive amount from wildlife rehabilitators I've worked with over the years. Vet techs in practice, vet students who came to pause for externships to learn from me and the staff there. I would learn a lot from them about how they are being taught in the various vet schools, because every vet school is a little bit different. All of the curriculums have the basics, but they're taught in different ways. And so learning from the students, learning from other teachers. If you ever think you don't need to learn more, or if you stop learning, please go do something else.
Right. Totally agree. Find your passion elsewhere.
Yeah. And just show up, be available to help. And just like you get to Carnegie Hall, practice. It takes time. It takes paying attention. Show up, learn what you can, apply the nuggets where you can.
Right. Oh my gosh, that's so wonderful. The other thing that struck me too is that a lot of us have different learning styles, and teachers often teach in the learning style that's best for them to learn.
Right.
But it's not always the best way for a learner. So if you are working with a mentor that knows a lot, but you're just not understanding or things like that, get an additional mentor. Don't jettison the one that you have, especially if they've got wonderful information, but see if you can't find also another one. Don't put it on yourself like, well, I just can't learn this. I would push back and say, yes, you can. It's just you have to find an instructor or a method or something that works for your learning style. Right. So you just keep pushing. And Dr. John, you mentioned all the different places that you can get information, whether it's books, conferences. I was also thinking like state organizations. And if you don't have a state organization in the state that you live in, find another state organization. You don't have to be a part of a state that has an organization. I mean, you can be outside that state and often be a member. So you can learn from them. The National Wildlife Rehab Association, the International Wildlife Rehabilitation Council. Those are awesome places to find community, but also find people that are willing to help. You go to a conference and you hear a talk that just blows your mind. And you're like, this is the best thing since sliced bread. Go talk to the presenter. Go talk to them. They're just, in my experience, everybody is always willing to help and share and everything to improve this profession. Anything to that? I was just definitely thinking about the state organizations.
Yeah, and don't be afraid to introduce yourself to someone who's speaking at a conference. They're there to share information. They want to help. So it's rare to find somebody that doesn't in the wildlife or the veterinary field. So it's rare to find somebody that doesn't want you to learn.
Exactly.
So because that's what everyone is there to do. So don't be afraid to learn from them, and to be able to access them in some way by email, by just checking in now and again if you're uncertain about something. And
Exactly. And it can be hard, right? I remember being so intimidated by people up there like that know so much more than I. But we have all been there, all of us.
Absolutely.
So I've certainly been there. I know Dr. John's certainly been there when he first started out. So please, that to me, that would be one of my top takeaways, is that, be brave. Talk to them. Talk to these people.
Yeah. And then when you are sharing information, when you are teaching another, be certain of your foundation of knowledge and information. Know that the information you're passing on is valid, that is accurate, and it is correct. Please do not pass along conclusions that are based on speculation, assumption, or opinions without some substance to back them up. So sharing that information depends on you and your circumstances and the audience. So many of you have done teaching at conferences. Many of you aspire to do so. Please do so. Put yourself out there for seminars, workshops. If you're working with the volunteers, make sure that your volunteers are trained in a way that's not necessarily one-on-one, but if you have a group situation of either local rehabilitators, regional, statewide, or even national meetings, get your volunteers involved, not only learning from you, but learning from others in the field as well.
Exactly. So that probably would be one of your top takeaways. What do you think?
Yeah, absolutely. Absolutely. Yeah.
So what would be some of your pro tips / top takeaways about the art of wildlife rehabilitation? We've explored so much today.
Yeah.
Amazing.
Oh, yeah, and there's so much more that we could get into.
Well, and we may in another podcast.
Right.
I want to come back.
Yeah, well, the top takeaways, I guess, is that just the practice of medicine has traditionally been a mixture of art and science. My personal definition of the art of wildlife rehabilitation is that it is the human element of successful healing wild patients for restoring their health and function for survival in the wild. It's intangible, not easily described, and is developed over time through doing, learning, and using best practices. An important part of the art is simply observation, recognizing physical aspects and behaviors not typical for the species, and understanding how you can restore their function for survival. All along the way, having constant compassion and empathy for the patient, always keeping their welfare and well-being at the forefront of whatever you're doing, knowing when to back off and stop interfering with the natural healing process. And that's, I think, a significant part of the art is when you've tried multiple things that are just not working, or when a patient is presented, when it's best to just allow nature to work its magic in the best way possible for that patient. Mm-hmm. Having a deep knowledge and understanding of the natural history of species, and observing them in the wild senses, there's no replacement for that in a book sense, or even on the documentary and that sort of thing. Just actually seeing them in the wild. And as a wildlife rehabilitator, you're primarily working with local species. So hopefully you have a chance to actually observe those animals in their environment, in your environment. Having a strong foundation in the basics, in the fundamentals of healing, of the medicine, biomechanics, and physical therapy are crucial. And also using your knowledge, using your creativity to use your innovation and nuance in the approaches of how you manage them in captivity, manage the captive stressors, including pain, in the most effective ways that you can. And remember that there are a lot of management processes that will control pain, and it does not always include medication. Well, there's a lot in that.
There is.
But I think those are some of the key points that are mm-hmm. takeaways. Just realizing that it takes persistence, mm-hmm. perseverance, and communication with your peers, with your colleagues, with the vet that you work with. Right. Communication is always a two-way street.
Mm-hmm. It sure is. And it is, you mentioned this earlier, is one step at a time, and it's a lifelong journey, and we're right. always learning all of those things. So, hopefully people aren't feeling like overwhelmed by this, because
right.
we're giving you a little bit of a snapshot of what this is, but it's totally doable, one step right. at a time. And
right.
all
right.
of us have been there, and we can help each other. We can totally help each other with this. So, Dr. John,
absolutely.
I had so much fun talking about this. I hope you did too.
I did, and I thank you so much for the opportunity to share.
Oh yeah, you're so welcome.
I hope it's been helpful.
That was part 2 of my interview with Dr. John Huckabee, a wildlife veterinarian, on the art of wildlife rehabilitation. I'm so glad you're sticking with us in season 3. Next episode, Connecticut-based wildlife rehabilitator Deb Galle joins me for part 1 of a discussion on working with cottontail rabbits. We'll cover Deb's origin story, why being relaxed when approaching rabbits in care is so important, assessment upon intake, building a good relationship with your vet of record, and certainly a lot more. If you recall, we did a series of episodes on Cottontail Rabbits in Season 1 with Laura Davidge. Deb's approach is a little different, but you will hear a lot of familiar elements. There are many right ways to help an animal in rehabilitation, as you've just heard in my conversation with Dr. John. Wildlife Rehabilitation from Rescue to Release is a production of Partners for Wildlife, working hand in hand with wildlife rehabilitators and veterinarians to improve the welfare of orphaned, ill, and injured wildlife. Our executive producer is me, Gail Buhl. I'm the Partnership Coordinator for Partners for Wildlife at the University of Minnesota College of Veterinary Medicine's Raptor Center. To learn more about the Raptor Center and Partners for Wildlife, visit raptor.umn.edu. Our producer is Kirk Clockey. Special thanks to our guest, Dr. John Huckabee, Partners for Wildlife, and the Raptor Center at the University of Minnesota College of Veterinary Medicine. And that's our show. Hope you'll join us again next time.